The head impulse test is done to assess the integrity of the ear semicircular canals. So when doing that, the PT flexes the patient's head to 30 degrees of flexion. So flex the head to 30 degrees of flexion and ask the patient to fix his gaze on a target. In that case, let that target be my nose. So sir, please stay your gaze at my nose. So I will do this test. Are you ready?
Yes.
Okay. Okay, thank you, sir. So as you can see, my patient is normal because a normal response constitutes the patient's gaze being maintained in fixation to the target all throughout, even with all the unpredicted swift maneuvers and turns of the head. While an abnormal response will be if the patient is unable to fix his gaze on the target and uses a corrective sakad to bring back the gaze to the target. So lesion site will be determined to the side of the head where it was turned, where the corrective sakad had occurred.
So, gagawin natin ay head shaking induced nystagmus test. So, bago natin gawin yan, kailangan muna natin malaman kung yung patient ay may masakit po ba sa leg nyo, may stiff neck po ba kayo, or kaya niyang gumalaw. So, kapag wala, pwede na tayong magpatuloy. So, una natin paggagawa sa patient ay pwede pong himuko kayo, mga bandang 30 degrees lang. Tapos, ang gagawin natin, head shaking. So, yan. Ito yung isang cycle. So, gagawin natin siya ng 20 cycle. Tapos, ang bilis niya ay 2 cycle sa isang segundo. So, para ganun siya. So, gagawin natin yung 20 cycles na yun. Tapos pagkatapos ng 20 cycles na yun, 20, ay close yung eyes pala ni patient habang ginagawa yung 20 yun. Tapos, ito natin, mas maganda kung tatakpan yung mata para mawala yung fixation. Tapos, titignan doon yung nystagmus. Yung fast pace ng nystagmus, kung saan nakadirect yun, kung saan papunta yung fast pace ng nystagmus, doon yung healthy ear. Kapag pagdating naman sa slow pace, yun na yung may lesion ear. Usually, yung lumalabas to sa mga patient na may unilateral vestibular hypofunction. So,
the Dix Hallpike is the most commonly used positional test. This test can be used to determine if the otoconia have been displaced from the semicircular canal, thereby causing a condition known as benign paroxysmal positional vertigo. To perform this test, the patient is in a sitting position and the PT rotates her head 45 degrees. Maintaining this head rotation, the patient is quickly brought to supine with 30 degrees horizontal neck extension. The PT notes for nystagmus and asks the patient if she experiences vertigo. The patient is slowly brought to the original sitting position and the other side is tested. The side which reproduces vertigo and nystagmus is the side with benign paroxysmal positional vertigo. The dynamic visual acuity test is used to test for vestibular hypofunction. To perform this test, ask the patient to sit 10 feet away from the Semont chart. Ask the patient to read the lowest and clearest line possible. That is the static visual acuity test. To test for the dynamic visual acuity test, ask the patient to maintain her gaze on the Semont chart. The PT will rotate the patient's head 2 cycles per second and ask her what is the clearest and lowest line she can read. A decrement of 3 or more lines suggests a vestibular hypofunction.
Caloric test. The examiner alternately applies hot and cold test tube several times just behind the patient's ear on the side of the head. Each side is done in turn. For application of cold tubes, the direction of the nystagmus is opposite of the tested ear. And for the application of hot tubes, the direction of the nystagmus is the same of the tested ear. A test is considered positive if there is a presence of nystagmus vertigo.
We will be performing the subjective visual test to assess the integrity of the otoliths. Here is my SVV test device, and this is the side where I will be utilizing, and this is the side which will be used by the patient. So in performing this test, supposedly it's done in a dim lit room. But for purposes of demonstration, presume that we're doing this in a dimly lit room. So first, you have to ask the patient to align this luminous bar. Let that luminous bar be represented by this red line here to how they perceive it as vertical. So, Mr. Gemwell, please align this line or bar to how you perceive it as vertical. Hold it for 30 seconds. As the patient does that, the PT measures the degree of tilt from the vertical at the back of the SVV test device. So, thank you, sir. The normal response will be if the degree of tilt was within 1.5 degrees from the true vertical, and an abnormal response will be if the degree of tilt is more than 2 degrees from the vertical. Lesion site will be dictated to the site where the tilt was made. That's all.
Liberatory Semont maneuver. This maneuver is used for treating benign paroxysmal positional vertigo. The physical therapist should assist the patient through this positioning procedure. For this case, we are treating for right posterior SCC BPPV. The head is rotated 45 degrees to the left side. With assistance, the patient is then moved from sitting to right side lying and stays in this position for 1 minute. The patient is then rapidly moved 180 degrees from right side lying to left side lying. Note that the head should be in the original starting position. Left rotated nose down in final position in this example. After 1 minute in this position, the patient returns to sitting.
Exercises for posterior SCC and SCC BPPV. So, ang muna pong gagawin is i-rotate po yung head ng 45 degrees to the left. Then, yung sa opposite shoulder po, which is the right side, maglalay down siya, side siya. Tapos, the next one is i-hold siya for 10 to 20 seconds or hanggang mawala yung vertigo. Then, babalik siya sa midline, maintaining the head position. Then, i-rotate naman natin siya sa opposite side, 45 degrees din. Tapos, maglalay down ulit siya or hold for 10 to 20 seconds or hanggang sa mawala yung vertigo. Pwede siyang ulitin for 2 consecutive days.
The exercise for UVH to improve the VOR of the patient. In this exercise, we're going to use 1 or 2 paradigm. In a 1 paradigm, we are going to ask the patient to focus on a target while moving his head horizontally and vertically. And using 2 paradigm, ask the patient to move on one side, move his head on one side while rotating the target or moving the target on the opposite side. This exercise should be performed as fast as the patient can and for 1 to 2 minutes, 5 times a day. Hello po sir, ang gagawin lang po natin ngayon is gaze stability exercise po. Focus lang po natin yung eyes natin dito po sa target while moving the head to the right, left, up, and down po. So, as fast as you can po sir ha, for 1 to 2 minutes. And kapag may naramdaman po kayo any blurring of vision, slow down lang po natin yung head movement po natin. Okay po? So, sir, move your head. Maintain your eye contact here in the target. So, move your head to your right. Left. As fast as you can, sir. Right. Left. Right. Left. Up. Down. Up. Down. Up. Down. Okay po. Thank you po, sir. Using two paradigm, ang gagawin lang po natin is ganun pa rin po, move nyo rin po yung head nyo po on the right, left, up, down. Pero yung move ko rin po itong target ngayon to the opposite side. Kailangan pa rin po, maintain pa rin po yung contact natin ha, dito po sa target, eye contact. Then, kapag may maramdaman po ulit kayo mga blurring of vision, slow down lang po yung movement. Okay po? So, game na po ma'am. So, right, yun po, on your right, on your left, right, left, up. Up po, ma'am. Down. Up, down. Ma'am, up, down. Okay. So, ngayon po, tapos na po natin yung exercise. Ang gagawin na lang po natin is progression. Sa pag-progression po, pwede po natin gawin is increase po natin yung target distance po. Then, pwede rin po tayong gumamit ng mga backgrounds po na nakaka-distract po sa patient. And pwede rin po natin gawin yung exercise while si patient po is nasa standing or walking, naglalakad. Yun po. Stability exercise for BVH or bilateral vestibular hypofunction by enhancing the central programming of the eye movement. So, ang gagawin naman po natin dito is meron po tayong dalawang target. Then, ma'am, focus po muna natin yung eyes and yung head po natin on the first target, on the yellow highlighter po. Then, move po natin yung eyes po muna sa second target, then your head. Yan. Ganun din po yung gawin natin sa kabila. Gagawin po natin to for 60 seconds. And note po ulit natin if merong blurring of vision na maramdaman si patient. Okay? So, next po, pwede rin po tayo, ma'am, okay na po. Pwede rin naman natin gawin na pa-vertical position naman yung mga targets natin. The same instruction, focus po muna natin yung eyes and head po natin sa first target. Then, eyes po muna and yung head sa second target naman po. I-move po natin up and down. Okay po, ma'am? Okay. Ayan po. Sa up naman po. Ayan. Tapos, yung last na exercise naman po is isang target na lang po yung gagawin natin. Ask po muna natin na si patient na mag-close ng eyes. Then, kapag mag-close ng eyes, mag-move po sa one side. Then, maintain the eye contact sa target. Okay po, ma'am? Close po muna natin yung eyes natin. Move to right. Then, maintain po yung eye contact sa highlighter or sa target po. Then, open. Yan. Pikit po ulit. To your right, to your left naman po. Then, open po. Yan. To your right po ulit. Pikit. To your right. Open. To your left. Open. Yan. Okay po. So, progression naman po na itong exercise is pwede rin po natin yung target is malayo po. Mas distant po sa patient. And pwede rin po na yung patient po is gawin natin exercise while nakatayo po siya or naglalakad. Yan.
Postural stability exercise.
Ito yung isang exercise na pwede natin ipagawa sa patient na. Tayo, pagbuka po nung paa niyo po ng kaparehas lang po lang sa balikat niyo. Unilateral. Ayan. Tapos yung kamay po natin pagay. Ayan. Tapos mag-balance na yung patient. Pero laging on support tayo. Tapos pwede natin i-progress na bit close po na close out a little bit. Ito po. Tapos close eyes. Mag-balance siya. Ang tinetest natin dito, yung resilience ng pasyente sa pag-balance kahit na ano yung base of support, maliit, yung resilience. Tapos yung isa naman, yung ankle sway. Okay na po, so yung ankle sway naman po, yung pag-gayan niyo po ako, pa-medial, pa-lateral, pa-medial, isa lang balance. Tapos pwede sa anterior, posteriorly. Tapos, pwede natin yung progression ng circular motion ng naka-close eyes din. Ang gagawin natin dito, kailangan maturuan natin yung pasyente ng tamang ankle strategy sa pag-balance. Pag mahulog na o para mag-balance so yun yung goal natin. Tapos ang next naman dito, ang next naman na natin, yung tandem walking. Biyahin nyo lang po ako, sir. Yung ganyan. So, ayan. Tapos pwede yung progress natin, ibahin natin yung inaapakan niya. Tapos kahit naka-close din yung mata, so okay. Ibahin lang natin yung surface ng inaapakan niya.
Paharap, tapos ikot po kayo mula sa direksyon na inyong pinanggalingan. Start to add. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Tapos ngayon, para sa progression naman po, ang gagawin po natin is gusto ko pong isara po yung ang inyong mata habang naglalakad. Tapos, gagawa po kayo ng masikip na pag-ikot or pag-ikot. Okay. 1, 2, 3, 4, 5. Habang naglalakad po kayo, gusto kong ipaling ninyo ang inyong ulo sa kaliwa, sa kanan, sa taas at sa ibaba. So, okay. 1, 2, 3, 4, 5. Para naman po sa progression ng ating exercise, gusto ko pong bumilang kayo simula 100 pababa ang binabawasan ng 3 kada bilang. Example, 100, 97, 94, 91. Naintindihan niyo po ba, sir? Start na po tayo.
100,